My name is Els Rutten. I work as a genetic counselor at University Hospital of Ghent and as an endocrine nurse, self-employed, working with 25 hospitals all over Belgium. I give education to people with acromegaly, which is a rare disease and which is also my expertise. And as a genetic counselor, I counsel people with all kinds of rare diseases.
How important is a good patient-healthcare professional relationship when it comes to patient well-being and overall health outcomes?
So I would like to start with telling you something we did in 2016. We organized a patient journey acromegaly led by an agency with 6 patients and 6 endocrinologists. And it was a discussion between the patients and the endocrinologists. So the objective was to assess the journey of an acromegaly patient and to identify the gap between patient and healthcare professional. So through this workshop, they could determine their mindset during every stage of their journey and how they coped with the disease, which was an eye-opener for us. So what we learned about this workshop was that the patient has different emotional phases. So when he is getting the first symptoms, the patient feels worried, misunderstood, is very eager to find a cure or an answer to his problems. So when he is getting the correct diagnosis, patient is relieved when receiving the correct and final diagnosis. Another phase was the start of the treatment. The patient is unaware of the complexity of the treatment and implications of the disease. So accurate treatment does not reverse all signs, and treatment is lifelong. And another phase was the follow-up. So the patient tries to accept the situation as it is, yet he is sometimes unaware that follow-up is needed. So this learned us a lot because the needs are a quicker diagnosis by looking at the patient from a holistic point of view. Correct information, education, training, motivation, independency, the importance of compliance is very important. And also a solid and clear communication adapted to the patient with realistic expectations, support and care. The availability is very important, and also to encourage the patients. So my experience is that patients have lots of questions about the diagnosis, the symptoms, the complications, the treatment, the side effects, and it's very important to take time to inform them, to ask them what they already know from their physician or what they found out when looking for information on the internet. So it's crucial to listen to their journey, and step by step, you can explain all about the disease. I use a lot of pictures. For example, what's the function of the pituitary? So patients understand it much better when you can show them what it is all about. I also use a lot of examples when they have specific questions. I spend also more time to this specific issue. So I think it's essential to give them confidence and faith to calm them down. I find it important to involve their loved ones during the education, so people that are close to them can understand why they react in some way. Patients also feel lonely or are depressed, get isolated, struggle with lots of things. And I always talk about the psychosocial and emotional aspect of the disease, which is sometimes taboo, but most necessary to mention this. So I plan the education over several days, and patients can think about all I explained and can ask questions whenever they need. So you build a trust relation step by step over a few days or weeks. So I think patients I know patients value the personal contact a lot. Also that there is time to listen, that they can talk to qualified persons, and they appreciate the understanding and supporting role and availability. So they feel very grateful, becoming independent again, motivated, and really get stimulated to go on.
Can you provide an example or a story that highlights a positive impact of this strong patient healthcare professional relationship built on trust on the patient's well-being?
Because of fatigue and many other issues, patients stop their hobbies, stop their social contact. So when I can find their faith again and convince them, they will get better with the right treatment, with my help and other healthcare professionals' help. It's lovely to hear them when disease is under control and they talk about their hobbies again and having social contact. So when I give you a few examples of this, one of my patients stopped driving the car because the fatigue was so heavy. So when she was finally feeling better, I stimulated her to drive again the car, and she did. So which was great to hear and to look at her that she succeeded in this. So one of the younger patients started law school after a very long struggle when she felt better again. Lots of them travel again, what they gave up before the diagnosis. Also, one of them, which was interesting, had the courage to divorce her husband after a very difficult and toxic marriage. And she started a new happy life again, so which was very good. And she was very thankful for this. Also, one patient couldn't take care of her dog anymore because of her disease. So after a few years, I encouraged her to buy a puppy again, so she could go walking with him, which was very good for her. And a practical example, one patient could not find any shoes because of his big shoe size. So I looked for a good shoe technician in his area so he could wear shoes again. So nevertheless, I advise them also to dose their activities so they can go on with all their hobbies and social contact.
Do you have any practical advice for patients on how they can actively foster a collaboration with their healthcare team? Because I know sometimes it can be intimidating to ask questions. They feel pressured for time. Do you have any tips for patients that you could give?
It's important that they can go to people who are available. So whenever they can whenever they have questions, they can ask them whenever they need to. So this also comforts them that there is the availability. In my position, I also can contact their physician much easier than they can whenever they have medical questions. And also, on the information day, we give the latest news about new medication or new treatments. We give them brochures that could be interesting for them.
From your perspective as a healthcare provider, what are your tips for other healthcare professionals wishing to improve their relationships with patients? What can they do to make patients feel more at ease and build trust?
I think it's very important to listen to their journey. Every journey is different, but to listen to their journey and their issues and complaints and try to find a solution for them. I experienced that I need to repeat the education. And most important also to give them education à la carte, adjusted to the patient. Also give them the feeling that you are there. Find their faith again. Try to comfort them and do it step by step. Important to give them the right support and give them realistic expectations. Also to let them know that they are not alone. and try to stay in touch with him. Also, when they need to talk to patients with the same disease, to let them know whenever it is possible to do that.
Do you have any other final comments, or is there any additional resources you want to share?
Giving the education or talking to the patient à la carte is very important. You need to know who is in front of you, and you need to talk to them first, so you get to know them. And when they talk about their issues, you can talk about these issues and not say the disease is this, and that's the treatment. That's not the way to do it. So it's very important to do it the other way, especially in chronic rare disease. I know these patients have a very long journey. So I think it's important first to talk to them, and, sometimes it's silent also. So you need to talk about the issues they have or the problems they have. And sometimes they don't dare to talk about it. But you need to. It's important to talk about it, and find a solution together with the other healthcare professionals, also together with their physician. So yeah, I think it's very important to listen, very much to listen to the patient.